okay? Yeah, I'm fine. Did she get you? We are finally getting caught up on some of the less on fire items. So we're about to go out and do dental evaluations and floats on some of our horses who came in before Dr. Gina and I started, and some of them who came in early January. We were able to do recheck body condition scores, and we're targeting horses that aren't gaining weight the way they should be to make sure that we haven't missed something diagnostically. This is Littlefoot. Littlefoot's dental radiographs aren't super abnormal, but he's not gaining weight the way we want him to, and he's been dewormed, so we are going to sedate him, put a dental speculum on, and do a really thorough exam of his teeth just to make sure that's not the problem. If we find anything abnormal, we're gonna fix it. A little bit of a corresponding point on premolar 1. Pretty sharp ridge on the lingual side of the left mandibular arcade, but super fixable. And the lower right just has a tiny, tiny point on the first premolar. It's gonna be quick and easy.
Like stand so that my shadow is like in your face.
Oh, that's awesome! Thank you! We are gonna do some more diagnostics on Littlefoot. His teeth are in pretty decent shape. Dr. Gina's fixing some sharp points, but he's not gaining weight even though we're feeding him a lot. So we're gonna do a follow-up fecal egg count. He's been dewormed twice, but we're gonna make sure parasites aren't a problem, and we're gonna run a CBC chemistry to see if we have anything systemic going on. That is severe. That is a very severe ulcer, and it is old.
Oh,
Good eye, Dr. Gina.
It also looks like he has
It's
a cut
thickened.
up there or something.
He sure does.
That may be why he may not
Look at
want
that.
to
He's
eat.
got ingest effect up there. I'm gonna flush that out. Let's get that last little pointy bit
Okay.
off. And
Okay.
I'm gonna get stuff ready to flush. Good eye. Dr. Gina just found some pretty severe ulcers on the right side under the lip, as well as right up here. So we're gonna make sure we know what's going on. A really sharp, pointy grass seed. And he has one wedged. I'll show you. He has one stuck up underneath here that I suspect is under that whole thing. So I'm gonna grab some lidocaine and some hemostats, and we're gonna get that out.
Okay.
Dr. Gina found a little pocket within an ulcer of what appeared to be a grass on kind of spiky plant material. And so that's probably causing a lot of pain. And he also has ulcers on his lips, top and bottom. So he may be avoiding eating because his mouth hurts. So we're gonna get those out, and we're gonna treat him for pain and probably with some antibiotics. And we'll recheck that and see. His blood work is running right now, so hopefully he's systemically stable, but we don't have that answer yet.
Oh, that wasn't much, but.
Not the most helpful.
All right, so we just got done doing Littlefoot's dental. He had a few points, nothing super major, but we did notice that he has quite a few ulcers and spots on his gums and also on his lips where he has some grass-ons stuck in there, and we removed those. And we're gonna do some blood work and check a fecal on him because he's not gaining weight like he should. So we're just gonna evaluate him, but his dental went well.
So we have Cinder here. Cinder was under training evaluation with Corey today. She's been really great. She was picking up all her feet, and she's having some difficulty with her right hind leg. So we are going to sedate her a little bit so we can get radiographs of that leg and also evaluate her teeth. And if she's got dental pathology, we'll be floating her teeth today as well. Oh goodness, are you okay? Yeah, I'm fine. Did she get you?
No.
Got me, but I'm fine.
Kimberly!
She didn't get me very
All right, trade
hard
with
because
me.
she was sleepy.
Trade. We're trading off.
Who? What?
We're trading
Where?
off. I don't want anybody to get kicked. Are you sure you're okay?
I'm fine. Like she got me, but it was right in the middle of my leg.
All right. Here.
And she was like, it was a very weak kick because she's sleepy.
Okay,
I'm glad
but
she was sleepy though.
Still not great. Corey, how would you feel about holding this front leg up for us?
Yeah, you bet.
Okay. Please do not get kicked. So like that's an arthritic change right there. See how similar that looks to this?
Yeah.
So it's a lot harder diagnostically to tell. And like this, you could look at it and be like, that looks like a bony change, but because it's really consistent with all of this mud, it's probably just mud.
Okay.
Are you sure you're okay?
I'm seriously fine. I'm probably gonna have a bruise though. I'll probably be sore tomorrow.
Let's get some,
I'm serious. Like it was like a very
Okay.
light kick.
let's get some ice and surpass on
When my
that.
horse like kicked me in the chest,
Oh, Kimberly.
it knocked the wind out of me.
I
and
feel
was
so
laying on the
responsible.
ground for,
I'm
like,
sorry for
10
yelling,
minutes.
everyone. Okay,
I'm
she
fine.
nailed Kimberly's leg.
Yeah, but she's
Um,
like, it was a sedated kick.
Emily, can you find a big bag of ice or an ice thing for Kimberly? I know. Oh, her teeth look perfect. Look at this, Dr. Gina.
Oh yeah.
Like
Very nice.
absolutely nothing. We just finished doing some diagnostics on Cinder. Her right stifle is swollen. Her radiograph didn't show any fractures, so we think that injury is soft tissue. She did kick Kimberly while she was doing it, so that was not great. Kimberly is okay, she has ice on her leg. Her teeth were perfect. We put the speculum on and we looked at all of the arcades. There was nothing that needed to be done, but she is a very, very poor body condition. So we went ahead and ran a CBC chemistry that is running right now. We don't have the results, just to make sure that we don't have something systemic going on that we're missing. We just caught and sedated Cranberry, and we are gonna put a dental speculum on her and evaluate her teeth. If we find any pathology, we're gonna hopefully be fixing it today. We just finished taking a look in Cranberry's mouth. She has fantastic teeth. She had very, very little that needed to be done. Looks like somebody's taken really good care of her mouth before. So she is just thin because she was nursing a colt and didn't have enough groceries. So hopefully we'll get some weight on her.